it was doing a procedure. It was a dentist. So he was doing a procedure and he needed something. So he kept the finger in the patient's mouth and moved away to kind of pick up something. He say, suck it.
And so I was standing behind the patient, putting my gloves on. And then like, I didn't think anything of it. And then he said, I heard that. And I was like, heard what? And then he thought I farted. Patient can say that their husband doesn't know that they have a denture.
There's so many things that I think that we do that people really don't realize that we do. I think a lot of us are entrepreneurs, like me, myself too.
Hi, everyone. Welcome to the very first episode of Beyond the Dental Chair. I am Dr. Catherine Muldoon, a dentist with a passion for teeth and great stories. And I am here with a friend and hygienist that I worked with, Inma, and I will have you introduce yourself.
And my name is Inma. I'm a dental hygienist and your favorite tooth whisperer. We started this podcast because dentistry is wild and we're tired of pretending that it's boring. We are here to show you the real side of dentistry. Funny, honest, a little messy, and a whole lot of human.
The first section that we organized was what people think we do versus reality.
We are therapists, we're detectives, and sometimes babysitters of adults. There is a lot of things that we do when we have patients in our chair.
When have you been a babysitter of an adult? You need to explain that.
Oh, a babysitter, like when you tell them to move your head one way and they move it to the other side and like they don't cooperate. So it's kind of babysitting and guiding them like the whole time.
Do you think that we're their therapists, or like, I kind of think that most patients might think that they're our therapists, because like most of the time they can't even talk and then we just talk to them. So like, I wonder, being on the other side.
I absolutely think that we are totally therapists. Just imagine how many times have you have a patient in your chair and the first thing they do is like telling you their whole story.
I mean,
like
definitely
how their day was, like their family, like especially if you get an elderly person. And I love elderly patients because I know that sometimes they feel lonely. And they come to the dentist just to talk to us, which I think is great because somebody has to listen to them. But I feel that we almost need a room for them to go first and kind of discharge before they sit on our chair.
Yeah.
Don't you think?
It's actually like my ideal scenario. But yeah, I totally like actually you saying that made me think of like the times I've been a therapist for patients for sure. Like I think sometimes people would just come in to, literally get therapy.
Yeah.
Yes. Feel better. But like there's definitely a human element to dentistry. Like there's very much a human element to dentistry. But yeah, you're definitely right. I think that there is 100% a psychological element to dentistry as well. And I think oftentimes, like from a business perspective, a lot of the things that take up a lot of chair time are the things that require talking and relationship building. But like, I actually don't even think that needs to be done in the dental office or like in such expensive chair time. So that's kind of been like my MO, or trying to figure out how to do kind of like a hybrid to bring the therapy and the human element to dentistry, but then also make it to where it's the chair time is more cost effective for us, and then we can share.
It is important, right? We are there for our patients and we want to give them the time that they need, but we also have a job to do. So how do we balance both of them, right? And of course, being in dentistry, so many things happen. We hear it all. We hear sad stories, but a lot of funny stuff happened there. Have you ever had anything happening to you? It's like, I remember one time that I actually called one of my patients, and it was a regular that he has called before to see if I can fit him into my schedule, right? Because you know that towards the end of the month, we're pretty much booked out, and unless somebody cancel. So I actually called this guy, and my message, and I didn't realize it when I was leaving the message, but I say, hey, this is Ima, your dental hygienist, and I just want to let you know that I can do you at 3 today. So, so then, when he came in,
before, and I didn't know that it came from you. Oh my gosh,
that's looking from me. So when the patient came in, he said, hi, my name is so-and-so. I'm here to see Ima. She says she can do me at 3.
Oh my God.
And I feel that sometimes because that's the way that we talk to each other, right? Like in the back. So it just like it's slipped out to the patient, and we don't realize sometimes how wrong things can sound until after the fact. But now you cannot take them back because now it is in a voice message and it's just out.
Oh,
so yeah,
that is very funny.
Yeah.
I mean, being in the profession of dentistry, it is considered an oral profession. So, you know, we could joke about that all day long. But that's funny because I think I've heard a version of that story, but I didn't realize it was you.
That it was, it was me.
Oh my gosh, the office manager in my office, actually, she goes, yeah, Dr. Muldoon, we don't do our patients here. Like, okay.
No, yeah, just for the record, we don't do our patients, okay? we just do their mouth. We don't do our patients.
Oh my gosh, on that note, should we go on to the next topic, or do we want to spend more time talking about
I mean, there is no rush. Well, so this is a funny story that I heard, and this, thank God, did not happen to me because I would be mortified. But it happened to somebody that I know that actually had a patient, and it was doing a procedure. It was a dentist. So he was doing a procedure, and he needed something. So he kept the finger in the patient's mouth and moved away to kind of pick up something. He said, suck it. So the patient starts.
Oh, like, as in, like, was he doing
sucking his finger?
Like socket?
Sucking his finger. Yeah. So the patient started sucking the doctor's finger, but he was referring to the assistant to suck up the saliva.
They were doing bone graft and they were talking about a socket. Oh.
No.
Oh my gosh.
So she started to suck his finger, and then he like looked at her like, what the hell is happening? And the patient, of course, was mortified, and I bet you she never came back.
Oh my gosh. Well, I wish I remembered his name, but there's a dentist who actually he realized that he got punked because I guess, I don't know if he was getting punked or if it was just like an old school philosophy, but when you're making a denture, you want to make sure you have good suction. So we do all this border molding. And then I guess at the end of border molding, he wants to like get the posterior palatal seal. And so we do this like Valsalva maneuver where you like pinch their nose and have them blow out. Or I don't have them make funny faces. I guess his prosthodontist who taught him told him to put like a finger in the person's mouth and have them suck on their fingers. So, I mean, it wouldn't be like completely abnormal. Maybe if the patient was older and they've had someone do that, or who knows, but it's not totally out of line for the patient to think that. It's just like sometimes that's just funny, like a miscommunication there. But he just posted online recently that, he went to a continuing education class, and he was like, hey guys, at what point do you have them suck your fingers? And everyone looked at him like he was crazy. And that was the first time he realized that he'd gotten punked. Like, whoever told him. I don't know, or maybe it was an actual technique. I actually think it might actually work, but regardless, I think it would be kind of, I don't know if I
Yeah.
teaching that technique, but yeah, that's funny. That is super funny. I'm trying to think of
With
like a funny story that I've had.
with children. Oh my God, my funniest stories are with children. So when I first started, I thought that I was a super hygienist, right? And I was seeing 3 children. They were all siblings. And so I took them to the room, which was the pedo room, which also had like a sitting area. So I was thinking, let me take all of them back, take them out of mom's hair, hair for a little bit. So I took all of them 3 back and I told 2 of them, sit down here in this waiting area for the pedo room, which I can totally watch them from there, right? Well, I was working on his brother's teeth. Next thing you know, the kid that I had in my chair would not stop moving. So I had to, a lot of coaching. One of the brothers got up and it was pushing my real star. The other one took the water syringe. And it was like, it was squirting water everywhere. And I was like, oh, don't touch it. Wait. I had no hands to stop them. And that was so funny. And I was thinking, this is the last time. I would never do this again. I would take each patient one at a time. Because I'm thinking I could save time. I can take the x-rays in one and then on the other one, and then have them, do the cleanings one after another. And then the dentist will come and do an exam. And in my head, it just sounded really good and very organized, right? And I had it all worked out. But man, no, it did not work out.
What is that like? They call it Instagram versus reality. We call it like, hygienist head versus reality.
Yeah, absolutely.
I'm trying to if I have any, like, my vision versus reality. Yeah, I mean, I have so many of them. Gosh, what is another funny story? I don't know. I can't think of one right now. It'll come to my head. I thought of like an emotional one from being someone.
But it's just so much. There's so many, right? Oh my God. Another one. I remember one time that I'm putting my gloves on and one of my gloves fell on the floor, right? And it fell in a way that it was like, with the middle finger sticking out.
Oh, that's funny.
And I looked at the floor and I'm like, oh my God, if I wanted to do it purposely, I would not be able to ever. Right?
Yeah.
And so I knew the patient and because I was laughing and she was, what? And I said, well, you're not going to believe it. She was like, what's up? And I said, well, just look to the floor. And she looked at the floor. She was like, oh my God, how did this happen? It was just all by chance. So funny.
That's fun. I have a funny gloves story actually. So, when you put on gloves and like, there's a little bit of air and you like, if you squeeze the last little bit of air out, it makes a sound. And so I was standing behind the patient putting my gloves on. And then like, I didn't think anything of it. And then he said, I heard that. And I was like, heard what? And then he thought I farted. And then I was like, I couldn't understand what he was talking about. And then I think I had left the room at some point, and then I put the glove back on, and then it made the sound again. And it like occurred to me what he just said. And like, I just started cracking up and I was beet red because I was like, no, I swear it was the glove.
It wasn't me. It was so funny. It happened.
Oh. And then, like,
you were
back every single time since then. Like, it's like, I swear it was the glove. I swear it was the glove.
He would be like, yeah, right.
Glove. I think he was messing with me. He's like, I heard that. I think he knew it was, but he was totally just messing with me. And I'm like, I didn't get it until like later on. And then I was just like, I promise.
What about What about confessions? Do you ever had anybody confess something to you in the chair?
I mean, I
Yeah.
definitely have had women tell me. I've had probably more than one woman patient who has some sort of removable prosthesis, like a partial or a denture. Most of the time, it's a denture,
Yeah.
and have the patient like say that their husband doesn't know
Oh,
that they have a denture. So, like, we note it in the chart and make sure, because sometimes the operatories are open, or like people want to come in, or
yeah.
you want to discuss, and it's happened where, like, you know we want
Yeah,
to
then.
go over potentially putting implants in to make the prosthesis more comfortable for the patient. And like, we're like, how do we approach this? Because it's an expensive procedure. So we want him to buy into spending the money on this procedure. But like, I can't tell him what she's dealing with. She has to tell him that. So, that's definitely been like a different situation. But like, yeah. But then
It's
like the thought
challenging.
comes, like, he might actually like it if you told him.
Even that is like a kinky kind of thing. Like, yeah.
Like, I don't know. Like, you know,
I don't know. How can you actually hide something like that? That is the big deal. I mean, she never removed them, or obviously I guess that she
I
probably
mean,
never
yeah,
removed them at night,
yeah. So I think
you
she
know?
removed them to clean them, but I don't think she was like taking them out to sleep at
Yeah.
night. She was
So
just,
are her tissues like really
they were
raw?
inflamed, and
Because
so that's kind of like how the discussion came up, because we saw the
um,
tissues were super inflamed. We're like, you should be taking this out and cleaning it, and blah blah blah. And then, and then I don't know how it happened. It was actually in the hygiene chair more so than mine. So she told the hygienist, and
yeah,
the
yeah,
hygienist made sure that she told me so that I didn't, because she was acting like she was open with like her husband was like kind of there with her. So she, was
mm,
in the hallway and here and there. And then he would come in for consults. This is a different patient actually who came in for consults for like a pretty much like a full mouth rehabilitation. She was only partially a dentalist. So I was like, okay, if we, there's two ways we can do it. We can like do like an FP3 where they like level the bone and you get teeth in a day. That's like highly advertised on television, or we have like a more sequential way of doing it. The more sequential way will probably cost more, but it's a lot more dental visits, and, it's will maintain more of her tissues. So, it was like these are big decisions to make for yourself.
yeah,
So, you want the person that you're closest with to consult them with their decisions, or you, and if you're the patient. And like, it was super hard because he didn't know what she was dealing with. So, yeah, that was certainly a hard thing. I think it's harder when it's like she's partially a dentalist, and like there's cavities on almost every single tooth, and she doesn't want her husband to know that she has a bunch of cavities either, because she's embarrassed by it. So, yeah, but
yeah. How do you deal with that? I mean, it's like you.
yeah, I'm like, I had to tell her, I was like, at one, like, you have to tell him,
Yeah,
like, yeah, I
yeah.
did it.
It's not your place to tell them. I mean,
No,
she's an
I
adult.
can't tell him, and I'm like,
Yeah,
you know, not my place. So,
no.
like, tell me how I can help you. I will help you in the way that you tell me, but I can't solve this problem for you. I can be a therapist only so much.
I know, right?
Right
It's
now,
just
I
so
am the
funny.
dentist. I must maintain my role here. I do think there should be like a dental therapist, though. So I like started the concierge thing. I was like, we should have a concierge, just like kind of a mix of a
Yeah.
therapist. It's actually the I put my logo back here. It's like actually how I came up with my logo. I was like, okay, this is the dentist journey, this is the patient journey, and then they like cross here. And then I'm like, but we need to like come up with someone who like helps facilitate the in between for it, like a third party person who could potentially deal with issues like that.
Yeah, because you have your own business. You're not just a dentist. that work in the chair. You're an entrepreneur. You have your own business with aligners, and there is so many things that I think that we do that people really don't realize that we do. I think a lot of us are entrepreneurs, like me myself too.
Yeah. Well, I thought
So
I have so many people who will reach out to me on social media, especially when there was that direct consumer group going on. They would reach out to me on Facebook Messenger or Instagram Messenger and say, hey, what do you think I should do? Should I do this or do that? And then or even, I mean, currently I don't even do that anymore, but it's too hard to facilitate it. But and the value I don't think has been created quite yet for it. I do think AI could replace that, but currently, I mean, I'm in practice and my fees are high. And someone comes to consult with me, and then they get all of this information, and then they're like, "I can't afford your fees. What should I do?" I kind of think there should be a place for consulting with patients, and there is actually a practice out in California who does it, and has one person doing the consultation and the other person doing the treatment. So it can actually be done. There are definitely some hiccups, and there's definitely different styles and different ways to do it, things that I would tweak about it. But, here we are chatting about it. What was the next here?
it is fun.
People think we do versus reality. We already put in.
So that's what we do. And and we deal with a lot of situations that we just have to improvise because we're not expecting it until the patient gets there. I had one little girl and this was my fault, and I'm going to tell you why. Because she told me that she has been eating the little goldfish. Have you ever eaten goldfish?
Yeah.
The moment that you get it wet, that becomes like a paste, right? So she's been eating a lot of goldfish because she got out of school on the way to the office, and every single tooth and every single molar and groove in her mouth had goldfish on it. And she said, I've been eating goldfish. Do you want me to brush my teeth before that? And I said, no, it's okay. I'm just going to go ahead and clean your teeth now. You don't need to brush them. Boy, did I regret that. It's it was so difficult. It took me a long time to.
Do you use the Cavitron on the kids?
I did.
Yeah.
I put it in the minimum. Yeah. I had no choice. I mean, it was bad. I think that even if she would have brushed her teeth, it still would have been some left.
I mean, I use the Cavitron. Everyone,
I mean, if you lower the frequency, and kids don't have sensitive teeth. No. That is an adult thing.
Yeah. Yeah. But I actually had a patient come to me recently who, she had come from a different doctor, and then I actually don't normally do cleanings, but they were put on my schedule for a cleaning. I'm trying out a new thing. And I did I was trying to use all of the things that this other doctor used because I wanted to make sure that the situation was more seamless. And so I was asking all the questions that I thought I could possibly ask. And then I went and used the Cavitron, and then I was like, okay, sorry, this little the saliva ejector is different. I'm it's a little different than I'm used to, and then she told me, she's like, oh, that was the first time someone used that spray thing on me. And I'm like, what? I thought everyone used the Cavitron. Okay. It's crazy. Yeah. So I can't even believe it. Not everyone will use it on all of their patients for their prophies, but it's crazy to me. Trying to think of some funny stories. I have a pseudo emotional one that we were talking about therapists. We had a patient, and he would come in with his wife, and his wife had pretty complex dental history, and so she was coming all the time, and we had pretty big treatment plan for her. They wanted to do little by little, and she was the sweetest woman on the face of the planet. I swear, so nice, and very nice to everyone. And he was just kind of a little grumpy when he would come with her. and I'm like, it's yin and yang. Cause like as sweet as pie as she could be, he was like kind of like a little grumpy with us. And so I'm like, you know what? Opposites attract. This totally makes sense. But then it turns out he came in one day and he said that she passed away. And like
Oh,
this man went from like, we were all upset about it, but he went from like the grumpiest man to being like the softest teddy bear on the face of the planet. Like, and I swear he would come in for therapy. Like he would come in because he's like,
yeah.
you guys knew her and you know me. And yeah, it was like, and he would be like crying in the chair. Like the hygienist would come to me, like, who was it? Chrissy came to me and she's like, Mr. So-and-so's in the chair and he's crying. And I said, he's crying? Like, what do you mean? Like, this man does not cry. Like, I don't think you understand. So he had a bunch of dental treatment too, and he wasn't taking care of it, but we were just there for him for like, anytime he wanted to, I swear he came back for perio treatment just so he could like talk to us more. And I'm like,
For sure.
I'm like, and he would come in for follow-up appointments even when he didn't really need it. And, you know, and we would just sit there and talk to him. And I'm like, I swear I kept on telling people, I'm like, we're his therapists right now. Like he's just here because we're his therapist right now. But he didn't do any of his dental treatment ever. But then he turned into the sweetest guy on the face of the planet. He kept on coming back. And then like one day one day he came in with, and like this is a couple of years later, he came in with another woman who was his, he said he just got married.
Huh?
And he met her at church in the choir. And she said, like, I guess all this time they hadn't been proceeding with the dental treatment or only doing it little by little because of costs. Well, his new wife says to us, she goes, you were so nice to my husband. I want you to redo all of his teeth and I'm paying for it. So
Wow.
like, yeah. So, I mean, and then she came in and did her teeth too. So it was like, you know, the power of like forming the relationship and just being there for someone is like super powerful.
It is all about relationships. It doesn't matter what you do. It doesn't matter what you do, or what I do, or what anybody does, right? Your job is your job, but the most important part of your job is building that relationship.
Yeah.
You know, that's our primary job, is building relationships with patients. Because after you do that, then they trust you, and and you don't do it just so they trust you. We do it genuinely. You know, we do care about our patients. We do get to know our patients. We cry with our patients. You know, when they're sad, we're sad. When something happened to them, we take it personally too, because we know these people for a long time, right? I mean, if one of our patients passed away, we feel it too.
Oh yeah.
Right? So we're humans. We're humans just like anybody else. We have our ups and downs, and like just like anybody else, you know. We have our days. Sometimes they're funny, sometimes they're not, but it's just part of life, you know.
Yeah, it totally is.
Yeah,
Totally is. I like similar story to that. Like I had a patient who they had like 5 kids, and I want to say he was probably about 12, maybe 13 years old. And he had a cavity on one of his. No, he must have been younger than that. I can't think of how. I have to do the math on this one. Anyway, he was really young, like a young kid, and he had a really big cavity on his molar. Like he had cavities on a lot of the teeth, but one ended up causing him pain, and he came in and he needed a root canal. His apex was fully formed, so like I could do it, but like I wouldn't normally do a root canal on a minor. Usually I would refer those out to the endo specialist, but I don't know if you remember the time when the military changed the insurance and there were like no endodontists in the area. But like when it went from like MetLife to United Concordia, and we had all these military dependents coming in, I like started doing so many molar root canals I couldn't even think straight. And then this kid, I'm like, I can't. Then the patient's parents said that they're like get his tooth extracted, and I'm like, what? Wow, he's
Oh
so old.
no.
Like, I'm like, I can't extract his tooth. And I'm like, you're doing it for like financials, and none of their kids, all of their kids had cavities, all of them. And, you know, I'm like, I can't. Like, they went through the financials, and I'm like, guys, I can't. I'm not taking this to that. So I was like, okay, fine. It's due to cost. I'm going to do the root canal for the price of the extraction. And people looked at me like I had like 5 heads. I'm like, you know what? I'll do it at the end of the day. No one has to stay with me. I will clean up. I mean, obviously, my assistant, she was sweet and she stayed with me. But anyway, like, you know, we're like, this is our charity. We're just gonna do the root canal at the cost of the extraction. After that, they came back for all their treatment. All 5 kids and the parents came back for all their treatment and did all of it.
Yeah.
Not like all at one time, but it's like they were like, oh, okay. I think you like build that trust with them. You're like, okay.
They were grateful, right? Because they know the situation. And the thing is that you as a dentist, you know the next chapter, right? You can see the future. You know that if that tooth is extracted today, the kid is going to need that tooth. So then they're going to have to replace it with something.
12-year molar wasn't in yet. So I was like, if I extract the 6-year molar and the 12-year molar isn't in yet, then like that's going to cause an issue. And then like it's just this snowball. And I'm like, if you can't afford a root canal now, like I think there was insurance coverage for it. So like, you know, you can't even like charge the insurance it's like it was completely not a financial move at all. Anyone in business would tell me that was an awful move, because it's like, oh, you can't give away your services for free. But I'm like, sometimes these things repay you in ways that are not direct. I can't extract this tooth, but what am I also going to do? Leave this kid in pain? Like, I can't do that either. So but I think they understood. They're like, oh, okay, this dentist really, really, really thinks this is important. So they then proceeded to, follow up with all the rest of their treatment. And I ended up like seeing him. He went into the military also. And like right before he went from, if I was there for 8 years, he was 17 when he left. So I probably did that root canal when he was like 11. He came in right before he went to the military, and we like did his crown for him because he was like going to go off and be enlisted or whatever. And I was like, it's so cute. I remember when you were a baby. Not a baby. He was like probably 11. That's probably the math there. But it's crazy.
So we're kind of running a little bit out of time, but I just want to remind everybody to continue to brush and floss your teeth. No matter what.
An electric toothbrush.
Yes, that's the best. An electric toothbrush. And just remember, like Dr. Muldoon, or Catherine, and me, and Emma. So we will be here every week with you, every Monday, 6 o'clock. If you have any questions or anything, we would love to hear from you. So you can you can tune in with us. You can leave us a message. So we will see you guys next week.
And tell us what topics you want us to discuss. Then I can start jogging my memory for funny stories or emotional stories or advice.
Absolutely.
Right?
All right.
All right. Well, that's fun. Thanks, Emma.